Well, I think that we're really at a turning point in the future of healthcare. This is probably as momentous an occasion as when we enacted Medicare. It's going to be different. It's going to have different responsibilities for hospitals and for physicians. And the care and delivery of that care to patients is going to be mightily different from what it was. The Affordable Care Act is going to be with us in its present form for the next 3 years. Even after the election of 2014, it's unlikely that it will be changed in a major way because the president is going to veto it if any bill comes to him that changes it. What is going to happen with both hospitals and physicians is they are not going to have a real understanding of what policy each of the people who come to visit them has. For example, they will not be certain that the people who are coming are in fact covered by the policy. Secondly, there are going to be very large deductibles and co-pays in some of the policies, and the net effect of that will be that the physicians will not know when that person comes into the office what kind of coverage they have. In light of the ACA, I think there's going to be a big change in the way in which post-acute care is both paid for and delivered. For the first time, there is going to be a responsibility of the hospital itself for what happens after the patient is discharged. 2/3 of the cost of care is after the discharge from the hospital for the original episode of care. This really is a turning point in healthcare. For the first time, hospitals are going to be responsible for what happens to the patient after they leave the hospital, not only in terms of coordinating the care, but also in terms of financial responsibility for much of what happens. We really would like you to come to the seminar in Key Biscayne, because we're going to teach how to do this. We're going to teach post-acute care and the hospital's responsibility for that care. We're going to teach how you work with insurance companies, both the commercial carriers, Medicare and Medicaid, so that you will have more responsibility for post-acute care and will get some of the savings as a result. We hope that you'll come. We hope you'll bring physicians and your board members, your leadership, to learn all these new things. We'll teach you. We think it'll be worth it.